What's up, moms-to-be? I'm Madge the Vag, and I'm entering my 8th month of pregnancy. That's right, I'm up the duff, and I'm here at the doctor's office, ready to find out what to expect in my 3rd trimester. So join me. Can you tell I'm pregnant? Do you know what to expect at my 8th month appointment? Do you know anything?
Oh God, no.
What I should ask? What I should do? What should I wear?
Yeah, I'd be comfortable. That's what I would do.
Sweatpants.
Sweatpants.
Is the baby ready? Is it in position?
It has to get in position. Head down.
Head down. They might be
those feet
breed.
coming out for you. You can't do
Exactly.
that. Okay.
Relax, keep off your feet, and I've always heard pickles are a good idea. So maybe
Pickles? Where do I
Yes.
put them?
that. Hopefully in your mouth.
Okay, that's what you meant. Got it. Hi, Dr. Baralot. It's so great to see you again. And again.
It's nice to see you for your routine obstetrical visit.
Shall we do this?
Yeah, how are you feeling today?
Well, I'm feeling pretty good. I'd say I'm feeling very big, though. Is that normal? How much should I be gaining at this stage?
So in the beginning of pregnancy, about the first 3 to 4 months, you're gonna gain about 3 to 4 pounds. After that, until the end of pregnancy, you're gonna gain 1 pound a week. But I'm gonna measure your belly today to see how your uterus is growing with baby. So I'm gonna take my tape measurer and I'm gonna feel where your pubic bone is. And then I'm going to measure to the top of your uterus. You're measuring 32 centimeters. After 20 weeks, when your uterus is at your belly button, you should be measuring the same number of centimeters as you are in weeks. So right now, it looks like baby's growing just fine.
Look at that. The baby's doing great.
Are you feeling any leakage of fluid or any vaginal bleeding?
No, I think there's more discharge than I'm used to, though.
That's definitely normal. It's, again, your vagina has a lot more blood flow going to it, so it's a little bit more engorged, and it just allows more of that moisture and normal discharge to form. So all of that is normal, as long as you're not noticing a big gush of fluid or constant trickling where you feel like you're peeing, but you know it's not pee.
Okay.
Regular little extra moisture or wetness down there is normal.
Is normal. Okay. And should it look a certain way or be a certain color?
It shouldn't have an odor. Clear to white is normal. Anything yellow, green, brown, or red is something we'd want to avoid.
So you tell your doctor.
Yes.
Okay.
I can definitely sit you up now if that'll be more comfortable.
Okay. My favorite thing to talk about, my vagina. I like to talk to her. I like to see what's going on. I don't know what's happening. How is she doing?
She's doing great. You can continue to talk to her even though you can't see her. She might look a little more swollen or engorged than you're used to. Could even be a little discoloration. Might look a little more blue hue to it because of the increased blood supply going to the vagina.
Right.
But she's doing fine.
Smurf vagina. This is a thing.
It is.
Okay. So she's fuller now.
Yes.
Full and plump.
Yes.
Oh, good for her.
Yes. You might notice some different sensations down in your vagina. One, as the baby gets lower as you're getting further along, but also because of that engorgement, you might notice a little bit more fullness, sometimes some discomfort, but definitely some changes to your sensation, which you might notice during relations with your partner also.
Ooh, relations. Well, let's talk about relations. Let's just get to it. In my 2nd trimester, it was just nothing but Humptown. I wanted to go to Humptown every day. I wanted to be the mayor of Humptown. Now it's like Dry Town down there. I'm not interested. It's no touch me town. What happened?
So in your 2nd trimester, one, your uterus isn't as big as it is now. You got over your nausea, your exhaustion got a little bit better. So you're feeling less fatigued, having more energy, and you're pretty much making up for the time that you didn't want to do anything in your 1st trimester. Now that you're into your 3rd trimester and your belly's just getting bigger, you feel uncomfortable. You might not necessarily feel the best about yourself because things are changing throughout your body. And again, with the vagina having more engorgement, it might just feel more sore and you're not interested in doing anything.
She's not up to it.
Not up to it.
She needs a break.
Yeah,
She has a lot to prepare for. We don't have that much time to go.
exactly. And that's totally normal to not be interested or to have waxing and waning of desire to have sex during pregnancy.
All right, well, I feel better about that. I'll let the partner know. Now, is this thing gonna lower at some point so I get a little more space, or what's happening?
It will lower a little bit as the baby descends into the pelvis. That should be happening anytime now, and it's just baby getting in position to get ready. So you'll get a little bit more space, but at the same time, baby's continuing to grow. So you might not notice a significant drop in your abdomen with the top of the uterus, but you might start feeling a little bit different. If you're short of breath, your chest is hurting, and once you stop moving, you're not able to catch your breath, that's something you'd want to let your doctor know.
Talk to your doctor. Okay, that is very important. Thank you. I've heard that the baby, it can hear some things from in there. Should I start playing him some Madge videos? Because he's going to be seeing my vagina up close. And should I prepare him for what's going to happen?
I mean, he'll definitely know your voice, so he would respond well to hearing the Madge videos, and it's obviously very educational, so we can start him off young.
He knows this voice. Isn't that great?
Very great.
Well, thank you so much, Dr. Baralot. It was so great seeing you, and I cannot wait to see you again. But don't worry, next time I probably won't bring all these cameras.
It's all right. The more the merrier.
Well, I'm getting toward the end, and it is starting to get a little uncomfortable, but that's A-okay because at least this baby's nice and cozy. At 34 weeks, he's measuring in at 17 inches and 5 pounds. That's big. And he now has working pupils and lungs, and that lanugo, the hair that covers his body, it's almost gone. Wish mine would go away. There's a lot going on in there, so if you want to learn more about what's happening with the baby, check out my friend Prego Nancy. I'm Madge the Vag. If you have any questions or comments, put them in my box. My very full inbox, that is. Oh, and check me out on TikTok. Tickety-tock.